All right. Well, this is Graceful Touch Speaks Out. We are answering massage questions here about questions you would have related to massage. This today is, it's March 25th, and my name is Guy Severson. I'm the co-owner of Graceful Touch with my wife. We've been in practice for 4 years, and basically just going to share this information out with you as we move forward. The first part of this is to ask the questions, and actually that's going to be the primary part. But before we go there, I wanted to let you know we're getting ready to start couples massage training, where we teach people how to do couples massage on their partner, be it their mate, a significant other, friends, and whatnot, learning how to do a relaxation massage with each other. I'll have more of that coming, information coming about that in days to come, but for now, just stay tuned. Now the question is, first question I have for today is, how much should I tip for a rub and tug massage? Well, the question on that is, it's what type of massage? Rub and tug. Kind of thinking Swedish massage there. Though it could be something like deep tissue, although I'm very much against traditional deep tissue, and perhaps someday soon I'll share why. In fact, maybe I'll even do that today. But so what I kind of think about as a rub and tug is a Swedish massage, a Swedish relaxation. On our books, a Swedish relaxation is probably the least cost type massage. So let's say, I think for us it's like $64.99, but let's just to make numbers round and whatnot, let's say 70. So your tipping part should be 10 to 20%. Now, 10% of 70 would be 7. 20% of 70 would be 14. So there's your parameter. Between $7 and $14 would be customary. However, if your massage is really, really good, you might want to consider tipping more, to a point. I know of one massage therapist who received a $100 tip, and they were told, I expect more when I come in next time. They probably shouldn't have taken that tip. Largely because they were setting the parameters of expectations which go beyond the scope of a massage therapist in ways that could get them legally, ethically, morally in trouble and cause them to lose their license. And you wouldn't want to do that. At least I know I don't want to do that. Let's go ahead and visit that point as it relates to deep tissue. A lot of people, when they call up, they ask me, what type of massage should I get? I don't like deep tissue because it hurts too much. But I've got painful muscles, I need some help. Well, I know I'm completely going against the industry standards here. That's okay. Over 400 reviews on Google in less than 4 years. That's okay. Here's why. There are ways to do muscle therapy massage without it hurting. That is really, really important to make sure that your massage that you're paying for and that you're purchasing is not something that you're going to have to suffer through. I hear people saying 2 to 3 days later they'll feel better, so it's worth it. That makes no sense to me. Now, is there going to be some discomfort in massage? Yes. But to the level of what is brought to the table in a traditional deep tissue massage, my answer would be no. 100% no. It's not okay. I have been told many times that they cannot believe that they can get out of pain without it hurting. Not only is that possible, but the benefit of removing pain without it being a painful massage is your muscles aren't fighting back. Thus, the work that the therapist has to go through, plus the discomfort that you have to endure, are completely different. I've had some people say they just don't like the approach that I take for massage, and that's fine. I've got far more people that come to the table and says, finally, someone knows how to help me with my pain issues without causing more pain. Why would I want to cause pain when a person is coming to get a massage in order to remove pain? There are ways that I use to make that happen. One such way is what I call reverse deep tissue. The problem with reverse deep tissue is it doesn't exist. At least not outside the arena of graceful touch. It requires breathing and trigger point pressing at the same time. It's a very light massage, hardly feel it at all, and yet by the time it's done, the client is like saying, I've never felt so good in years. Not only that, but I oftentimes, especially if people have been to me for 2-3 times, oftentimes what I find out is that it lasts longer than a traditional deep tissue. It doesn't need to hurt as traditional deep tissue. It lasts longer. It's just a much better way, a much better approach for a massage. So let's go to another question here. Is it normal for a massage therapist to massage my inner thighs? The answer to that, unfortunately, is no, it's not normal. However, the reason it's not normal is massage therapists simply seem to want to avoid them. Now, one thing that's important to mention here is if you're uncomfortable with any aspect of the massage that you're getting, all you should need to do is speak out and let your practitioner know that it's not working for you. After all, who's paying the bill? If you're the one paying the bill, shouldn't you be the one setting the parameters? Yes, okay, if you go to the store and you get a bottle of ketchup, it's going to be a bottle of ketchup. That's just what it is, except for if you choose a different brand or whatnot. But when you're talking about a service-oriented business or service, it can be custom-made, tailored to just what you do. I often hear massage therapists just go through the motions and don't tailor fix it. I just don't think that's okay. Our opportunities are there to help people. So yes, I massage the inner thigh, and if it's a steady returning customer, I will have them bring a pair of loose-fitting shorts with them. Another area that I don't avoid, I do ask for permission with, is the glutes. With the glutes, I don't just put my fingers in. That's just not going to work out so well. What I use is I use my elbow, and I use trigger point philosophy. By the time I'm done doing that, and it doesn't need to be heavy, hurting, or anything like that, by the time I'm done with that process, the client is, well, they're praising my name. Let's just say that. And so you've got the inner thighs and you've got the glutes. There's one other area, and that's your pec major area, right above your breastbone. And I've also heard clients say that massage therapists just don't work here. Well, we do. We do so professionally. And this can be a tremendous part of where people's arms problems are coming from. So not working them is really a disservice to your client base. I don't think they necessarily need to be worked every time. It just depends on what your client needs. Let's see. So that covers that. We've got, yes, you can massage the inner thighs, but is it normal? No. You can also massage the buttocks, the up above the breast, having a memory moment on exactly what that word is. Pec major, your pec minor, lots of different muscles in this area. So let's see, I've got one more here. Is massaging your head bad? No, not at all. I'm not going to build a lot into that because it's time to bring this to a close. But if you massage your head by doing rubbing and things like that, not a bad idea. Another thing you can do is to pull across the sagittal suture line. That's the middle of your head there. And the other thing you can do is to pull up on your occipitals. That's in the back of your head. You just kind of pull up on them, hold them, and release. All of this process can help reduce and or eliminate headaches, especially if those headaches started back here or in your rhomboids and such like that on your back. Well, there's 3 questions for you. I look forward to sharing more answers as we go along. Remember to be watching for more information about our couples massage training program that's coming. And until next time, this is Guy Severson from Graceful Touch Massage Therapy, wishing you a more comfortable, productive life as we move forward through 2022.